continuing with our discussions in different body systems, we move into Chapter 24 to look at specific infections that affect the digestive system. The digestive system is a little bit different to discuss because we are discussing a system that relies on heavy amounts of normal microbiota for normal activity. So it is a little bit different as we go through. As usual, let's go through a quick review of the digestive system. The digestive system covers the body starting with the oral cavity all the way down into the internal organs until the digestive system exits the body. So if you think about it, the digestive system actually has a direct connection with the external environment, allowing it to have a lot of exposure. We constantly put food and drink into our mouth, so we're constantly putting different microbes from our external environment into our digestive system. Because we are constantly putting these things into our digestive system, we build a huge amount of normal microbiota. We have normal microbiota that live in our mouth, in our stomach, in our intestines, all the way through our digestive system. Very often, when we do have an infection of the digestive system, it will stem from something that we've ingested that is perhaps different from normal, or it may be a microbe that is a particular pathogenic strain. We may have something going on that leads to an over-competition between the normal microbiota and something we've ingested. But that is very common. We're not going to spend too much time discussing things that will cause like an upset stomach, but a lot of times those are results of infections that we are ingesting different pathogens. And so just a little bit of terminology as we go through. I'll let you read through each of these, but as usual, we have different terms for inflammation in different areas. So you need to be familiar with some of these terms. Gastritis, enteritis, hepatitis, those are, and colitis, those are inflammations of different parts of the digestive system. And then these two terms at the bottom, I'm pretty sure everyone knows what diarrhea is. Dysentery, you can kind of think of as a really extreme form of diarrhea that leads to excessive water loss, dehydration, and some potentially deadly effects if not taken care of. So that's a little bit of an anatomy review, and now let's move on into our first discussion and first infection. As we look at diseases of the mouth, we have to look at a little bit more anatomy. So if we look at the anatomy of a tooth, you can see there's the portion of the tooth that is external, where we have the outer coating of enamel, and then we have a coating of dentin underneath. Then we have the internal portions of the tooth, where the tooth goes down into the gum line, where we have the dentin continuing, and then we have the pulp in the center. And what's important is notice the pulp has a lot of blood vessel network, and those blood vessels will connect with other blood vessels. So if you do get an infection that goes all the way through your enamel and your dentin and into your pulp, you now have a microbe that has access to the deeper layers inside of your body by going anywhere it wants in your bloodstream. Okay? So let's talk about this first infection leading to a dental carie. A dental carie is more commonly known as a cavity. Cavities occur when you have a lesion caused by some sort of bacteria that's causing damage to the tooth, where you'll see some sort of decay going on. And this is kind of the little drawing of it, where if we look down at the bottom, you can see this is an example of tartar. Tartar forms when you get a hardened area of bacteria. So if you kind of look at this as a progression, we don't have a picture of it, but before this tartar, you would have plaque. Plaque is simply a biofilm of bacteria, lots of different bacteria, the most common being Streptococcus mutans. If the plaque is not removed by normal brushing, flossing, things like that, then that plaque can harden and become tartar. The tartar, or if you're in the dental field, typically called calculus, can really stick to the teeth, and it gets hard to remove, and then regular brushing can't remove that tartar. If tartar remains, then you end up with this bacteria leading to heavy acid production that dissolves the enamel, So that's what's shown here. If left long enough, it will begin to dissolve the dentin, and you get this decay. When you see decay, that's when you go to the dentist and they start probing, and they'll get the sticking, and if their little instruments stick, you have decay. That's when they'll have to drill out anything that's decayed and covered in tartar and then put a filling in. This can get really dangerous if your decay extends, as I said, down into the pulp area where you have access to your blood vessels. It's very common for people with poor oral hygiene to end up with heart disease, where these oral bacteria end up traveling through the bloodstream and becoming a secondary infection in the heart. The best thing you can do for teeth and any sort of decay is to try to prevent it from happening. So regular brushing and flossing will mechanically remove any of the bacteria biofilm, as well as the use of fluoride, which is in a lot of our toothpaste, phenols and heavy metals. Those are going to be found, remember, in a lot of our disinfectants like Listerine and things of that nature. So kind of sticking with the same theme, let's take this a little further and look at what's going on with periodontal disease. Periodontal disease is inflammation and damage of these areas around the teeth, so in the gums. So a lot of times we will not want to floss. We may brush our teeth well, but if we don't floss, we don't get the bacteria out of these crevices down here between the gum and this outer enamel layer of the tooth. So we'll end up with gingivitis. Gingivitis is the inflammation of the gum area itself. If gingivitis is not treated and the bacteria aren't removed, you'll begin to see tooth decay here at the level of the gum line, and that's where you get the periodontal disease. And again, this can lead to infection into the pulp cavity, where you end up with the infection in the bloodstream. Continuing with diseases of the mouth, let's look at a disease of the mouth that is not caused by bacteria. Instead, it is caused by a fungus. Individuals can end up with an overgrowth of Candida albicans in the mouth. So remember, we've talked about Candida albicans many times. This is yeast. That is the yeast that normally lives throughout your body. If it grows too much in the mouth, you end up with oral thrush. Thrush is most common in infants because they have not developed enough of an immune system to prevent this overgrowth. We also see this in patients that are immunocompromised in some way. It's very common in AIDS patients because their immune system is so heavily damaged. Thrush is characterized by the presence of these white patches throughout the back and roof of the mouth, and this a lot of times will even form a complete pseudomembrane, which is what we see here in this extreme case of thrush. Another what we consider disease of the mouth is mumps. So remember, we've already discussed the MMR vaccine. The MMR vaccine protected against measles and rubella. Now we see the reason for this other M, the mumps. Mumps is caused by a viral infection of the parotid glands. The parotid glands are two large glands that line the throat cavity. When you get an inflammation in these parotid glands, you end up with the characteristic swelling of the parotid glands that leads to this kind of large lump in the neck, throat area. Mumps is heavily contagious. It's transmitted simply by respiratory droplets, and it causes, in addition to this swelling, which allows us to recognize the infection, it also causes high fever, muscle pain, headaches, loss of appetite, really, really bad infection that can ultimately lead to a viral infection of the nervous system. So those are a couple examples of infections in the mouth. Let's move on down and look at some infections of the gastrointestinal tract. So we're really moving into the stomach and the intestines. One particular infection of the stomach that you need to be familiar with is this first one on the chart, peptic ulcers. Peptic ulcers are large sores in the lining of the stomach. What we find is that if you have these sores in the lining of your stomach, you have the bacteria Helicobacter pylori living inside of those sores. This causes lots of pain, a lot of bloating, weight loss, really just very uncomfortable symptoms. All the others on this particular table, I would like you to take a look at. These are different types of what we would consider food poisoning. So I want you to look and notice that food poisoning can be caused by many different bacteria. Salmonella kind of gets the what we consider the bad name. Most people think, oh, you have a salmonella infection. But salmonella is really not the most common type of food poisoning. You can get a salmonella infection from handling eggs. That's fairly common. Most of our food poisoning is actually ingestion or handling undercooked meat, and that's typically more of a staphylococcus infection. But I invite you to really take a look at this table. I think it will help you to understand the differences between some of our, quote, food poisonings. But what I want to spend time looking at are some very specific infections of the digestive system. The first one is hepatitis. A lot of you plan to move into the medical field, so it's really important that you can keep these different types of hepatitis separate. Hepatitis itself means inflamed liver. So for all types of hepatitis, we will see an inflamed liver. When your liver is not functioning properly, you will see the sign of jaundice. Jaundice is most characterized by these yellowing in the whites of the eyes and yellowing of the skin. So let's take a look at the different types of hepatitis. Hepatitis A is a type of extreme food poisoning. So for hepatitis A, you don't have a whole lot of symptoms until you get those food poisoning type symptoms. Usually not serious or fatal, but can be. Hepatitis A is transmitted by contaminated food or water, and you can get a vaccine to protect you from hepatitis A. Hepatitis B is going to be a much more serious form of hepatitis. It's going to lead to a more common cirrhosis or permanent damage of the liver. The way hepatitis B is transmitted is by contact with infected bodily fluids, so blood exchange, semen, saliva. Hepatitis B, we'll see that commonly with sexual intercourse, sometimes sexually transmitted, sometimes healthcare workers handling infected patients. Hepatitis B does have a vaccine. Hepatitis C is typically going to be asymptomatic until the patient starts seeing this liver damage. Hepatitis C is transmitted by infected bodily fluid. It's the most common that we see with IV drug use and sexual transmission. Hepatitis C does not have a vaccine. So when someone gets a hepatitis shot, they're getting a immunity to hepatitis A and hepatitis B, never hepatitis C. So now let's take a look at some infections that are caused by protozoans. The first one is caused by a flagellated protozoan called Giardia lamblia. Giardia is a fecal oral transmitted infection that is most commonly seen in people that are traveling to parts of the world that their immune system's not familiar with and drinking contaminated water. With Giardia, it's going to be a little flagellate that lives inside of the intestines, and it's going to eat what's inside of the intestines. So it causes a lot of painful stomach issues, flatulence, nausea, a lot of cramping in the abdomen. So the key here is if you go somewhere you're not used to, don't drink untreated water. The next one on the list is a protozoan infection of Enterobiasis histolytica. This is an amoeba infection. This is, again, fecal oral transmitted, but this time you're ingesting the cyst. And cysts, if you recall from our discussion of protozoans, are highly resistant to things like cooking and treatment. Enterobiasis histolytica infection is much more severe than Giardia infection. This is an example where the protozoa is not just eating the contents of the intestine, but will actually begin to ingest the intestinal tissue. So we get a lot of bleeding, severe dysentery. It can be very dangerous for an individual. So that's a few examples of protozoan infections. Let's look at an example of a worm infection with the worm Ascariasis lumbricoides. Ascaris has got kind of an interesting life cycle. So the worm lives inside of your intestines. The way to get in your intestines is you have to ingest the eggs. Once the eggs are ingested, the eggs will hatch. The larva will leave the intestines, travel through the blood, and this is all just part of the life cycle for the worm to mature properly. Once inside of the blood, it goes to the lungs, crawls up the trachea. A little tickle in the back of your throat causes you to swallow the worm again. The worms get very, very large. And so what you see in this picture is an example of something post-mortem, where you see the intestines are almost completely blocked by these worms. This is a hospital worker holding the worms. Very nasty infection. The next worm infection is a hookworm. The proper name of hookworm is Necator americanus. Now there's lots of different hookworms, but this is the one that affects us in America. The way you get a hookworm infection is the worm attaches to your intestinal wall. Well, how did it get in your intestines? Not the way you may think. This particular worm has the ability to bore through your skin and then move through your bloodstream to get to your intestines. This is, if you've ever had your parents tell you don't walk outside barefoot, you'll get worms. Well, there's a little truth to that. You actually can get the worm. So if you think about it, the worm's living in the intestines of animals. So when the animal goes to the bathroom outside, now the larva, the baby worm, may be in the grass. And that's how you may step on the worm and end up with the infection. Another very common worm infection is an infection of Enterobiasis vermicularis, or better known as pinworms. Pinworms are very small, wiggly little worms. They will mate inside of the intestines, and they live in your intestines. So when you go to sleep at night, the female worm will then lay the eggs around the outside of the anal sphincter. That leads to itching, and especially in young children, if it's itching, a lot of people are going to scratch. Now the worms may be located on the hands and under the fingernails. So if those eggs were transmitted from the hand somehow to maybe children's toys and then ingested by another, then a new host would be infected with pinworms. So really the way that you will know a pinworm infection is occurring is most commonly the anal itching. But there is a lot of times abdominal pain from the worms living inside of the intestines. Our last infection is an infection of a worm called a tapeworm. Most people are more familiar with tapeworms. They lead to an increased appetite and weight loss due to the worm eating the contents of the intestines. And so, you know, that may not sound like that bad of a sign or symptom. Where tapeworms can be very dangerous is once the tapeworm grows large enough and it's not satisfied inside of the intestines, the tapeworm can then move to other organs such as the brain, forming cysts and leading to death. So what I have listed for you here are 3 of the most common scientific names for tapeworms that you do need to recognize.